Hi everyone, Dr. Hookham here. I decided to post a video with the aim of dispelling some of the myths that are out there about COVID-19 and give you the facts directly from someone that you may already know and trust. So I ask you to please listen to what I have to say and know that I'm saying it not to panic anyone or alarm anyone, but to empower you all to make some changes now that may change the course and outcome of COVID-19 in our community. What we all need to do right now is slow the spread of COVID-19. Now, there are many comments out there on social media that are saying, don't worry, it's just a flu. And you hear these time and time again in the community. Initially, when COVID-19 did first emerge from China, this is in fact what many of us thought and what many professionals did think. But however, with further spread and as further information comes to hand and we learn more from all around the world, we know that this is not true. I'm here to tell you that COVID-19 is not just a flu, and continuing with these types of comments will result in people with COVID-19 who have mild disease continuing to go about their daily routines and shedding and spreading the virus to others. So people need to understand how important this is. Otherwise, continuing this sort of momentum in society that COVID-19 is just a flu is going to be dangerous. We all need to acknowledge that COVID-19 is a global pandemic and it is an unfolding global emergency, and it requires each and every one of us to take it seriously, follow medical advice, and support the medical teams who are furiously working behind the scenes to try and keep you all as safe as possible. I should begin by describing what COVID-19 is. COVID-19 is a new virus, one that we've never seen before, that absolutely nobody has any immunity to. So we're learning about it each and every day. What it does do is it binds directly to an enzyme in the lungs that can lead to a respiratory illness that may then progress to respiratory failure and other organ problems or other organ failure. For the majority of the population, it will cause mild symptoms. It might be sore throat, fever, cough, shortness of breath. In a smaller number of people, it might just cause a runny nose, aches and pains, vomiting and diarrhea. The predominant difference noted here is that feature of shortness of breath. And this is because the virus is directly affecting the lungs. Another problem with COVID-19 is that it can be shed by a person for up to 20 days and can take up to 6 days before you develop symptoms. So this means that you could have the virus, be shedding it to others, and have no symptoms and not even know that you're doing it. So this makes it very difficult to contain and very difficult to slow down. Influenza is completely different in this regard. Influenza generally develops faster. It sheds for a shorter period of time. And when influenza goes through the community, many people have immunity to it, or many people have been vaccinated to it. So it spreads at a much slower rate through the community. COVID-19 has the potential to spread exponentially. So now the next part to understand is that the hospital systems only have a certain capacity. This capacity is designed to deal with a gradual spread of a varying number of illnesses throughout the year. And it's not designed for an illness that occurs essentially all at once and over a short period of time. So to be bluntly honest, our hospital systems will not cope unless we slow the spread of COVID-19. Our peers in other countries, in these new and unfolding epicenters all around the world, are describing their trauma when faced by a health system that cannot treat everyone, meaning that people around them are dying, that perhaps could have survived if the rate of spread was slower and the resources were higher. And note that these are well-developed countries with world-class medical facilities that are currently dealing with these COVID-19 epicenters. So, in order for us to help the hospital system in Australia and locally cope. And to allow those that need help to get the treatment that they need, we must slow the rate of the transmission and spread of COVID-19 right now. Here are some figures that may sound alarming. And what we need to do is not panic, because that will not help anyone. But we need to use the knowledge that I'm about to give you and that we're all learning, that we are, and the knowledge that we are gaining from other countries around the world to help better protect our community and for us all to be prepared. Australia is not immune to what is happening in other countries. Eaton, Australind and Bunbury are not immune. So I continue to research and read what is occurring around the world on a daily basis. And things are constantly changing and the information is constantly changing. But it does appear that COVID-19 has the potential to infect anywhere between 30 and 60% or more of the entire Australian population. The current numbers that we are hearing in the media about the positive COVID-19 cases are not a true reflection of the disease spread in Australia, as in Australia we are now only testing those who have travelled overseas within the last 14 days, or someone who has a close contact with COVID-19, or someone who has significant respiratory symptoms potentially attributed to COVID-19. So what that means is that these people who are just being tested in these very specific groups have been passing it on to several other people in the community well before being tested. And there is absolutely no real way of accurately tracking this anymore. GPs are no longer able to test suspected COVID-19 cases. Now, there is some good news, and the good news is that out of all of those infected, up to 80% or more will be perfectly okay, have a very mild illness like a cold or a mild flu type illness. And that can often just be treated at home with isolation and supportive treatment. But now this is the important difference that we all need to take note of. Up to 20% will require hospitalisation. Now picture 20% of those infected requiring a hospital bed all at once. That's 1 in 5 people. So of the 20% hospitalised, 20% of those will need intensive care unit and ventilatory support or ventilation. And then a small number of those that have been ventilated may die. So the global mortality rate remains uncertain, but for COVID-19 is somewhere between 2 and 7%. Seasonal influenza mortality rate is significantly lower than this and can't really even be compared to COVID-19. So that means 2 to 7 people out of every 100 could succumb to this illness overall. And over the age of 80, 1 in every 6 to 7 people infected may not survive. Now, there are certain groups that are more at risk, and these groups we need to help protect. This includes the elderly, those with a chronic disease such as diabetes, cardiovascular disease, chronic pulmonary disease. So what can we do? How can we help slow the spread? So we need to understand a little bit more about COVID-19. So COVID-19 is transmitted by a large droplet transmission. So for example, coughing or sneezing. So we need to protect the people from the droplets that are being left around on the surfaces, as COVID-19 can actually survive several days outside the human body. So we need to cough into our elbows, wash our hands regularly. How many times a day do you think we each touch our faces and then touch another surface? We could be transmitting the virus to others or infecting ourselves. And when we say wash our hands regularly, we mean you need to do a proper 30-second hand wash. And we've actually posted some videos on how to do this for adults and children. And hand washing regularly is very important. Also, more than anything, if we are sick, we must stay at home. We need to not go to work or go to the doctors if we have very mild symptoms. We must stay at home and then call your doctor or call us for advice. This applies to children and adults. If we become more unwell and we're concerned about ourselves or have symptoms that we believe might be consistent with COVID-19, then there are dedicated fever clinics located at the hospitals, and they are handling this. The reason why we try and have these dedicated fever clinics is to reduce the spread to others. In case you had COVID-19 and then came into the GP clinic and infected several other vulnerable people in the waiting room or the staff. Fortunately, the government have announced that if people meet certain criteria, they will be eligible for a telehealth appointment or telephone consultation with their regular GP that can be bulk billed. And we strongly encourage you to begin using this service. People that are eligible for this service include the following: over the age of 70, over the age of 50 with an Aboriginal or Torres Strait Islander background, if you're pregnant, a parent with a child under the age of 1, person with a chronic medical condition, person who is immunocompromised, or a person who is already self-isolated or under quarantine or already diagnosed with COVID-19. As GPs, we do need to start restricting face-to-face consultations for anyone who is unwell or at risk of COVID-19 from now. We should be using telehealth and telephone wherever possible and only seeing those patients who are well, who have no risk factors and need to be seen in person. This decision on who needs to be seen in person needs to be decided by a medical practitioner. And potentially, as things progress, it may be that it ends up everyone needs to be consulted using these remote telehealth or telephone services. However, at this stage, not everyone can be bulk billed unless you meet those criteria. Now, if you are advised to self-isolate, this doesn't mean you can just duck to the shops for 5 minutes because everything will be fine. It means staying at home strictly for 14 days. Otherwise, during that 5 minutes that you duck to the shops, you could infect several other people who then go home and infect several more other people. We must all stop travelling. We must stop mass gatherings. We must stop large social interactions, and we must do that right now. If we don't do this now, it might be too late later on. So we need to start social distancing. We must stay 1.5 meters away from other people. We must avoid public places and crowded places wherever and whenever possible. Now, this is not something I wanted to post, but I felt that my care for the community meant that I should use my position to help. What I am saying is, please do not panic, but use the knowledge that you now have to slow the spread of COVID-19. Please share this video with everybody. Share it with colleagues, friends, family, loved ones. Now, I'm more than happy to continue providing updated videos and information if that is something that the community wants or needs. Now, let's start looking after each other. We're all going to have a great week, but we all need to just remember all of the things that we've just spoken about. Bye, everyone.